Okay, Dr. Huebner here, Natural Transplants. I wanted to talk to you about a common question that a lot of our prospective patients ask us, which is how much density can I expect from a hair transplant? The answer to that is a slightly complex, but it basically depends on your hair type. So if you have very, very thin, fine, limp hair, you're not going to get as much density as, say, someone with thick, curly hair. It also has to do with the doctor, of course. Generally speaking, from a single hair transplant, if you dense pack an area to the maximum ability that you can generally recreate about 30 to 40% of the natural density. Natural density meaning of the density that you have in the safe zone in the back, the sides and the back. If you have fine limp hair, then generally it's closer to 30%. If you have thick hair, then generally it's closer to 40%. Sometimes it can even be more. We've had some African American patients, for example, that have very curly, thick hair. A curly hair is going to give you much more coverage than a fine limp hair. So generally speaking, anywhere from 30 to 40%. Now you never have to have more than one procedure. Everyone is different as far as how much density they want. If you have the means to do it and the time to do it, a lot of people will have another procedure in the same area as their prior procedure. That will give them anywhere from 60 to 70% of their natural density. That's what we call a finished product. However, 30 to 40% is well enough, more than enough density for many of our patients and never have any more procedures other than the first procedure. But you have the option as far as how much density you want to do several procedures in one area. Generally, 2 procedures in one area will give you hair that's indistinguishable from normal hair. 30 to 40% in many cases with density is often enough where people are happy, and it also can be indistinguishable from normal hair. So a lot of factors go into it. Here at Natural Transplants, the idea is to move as much hair as possible. Why would you want to go through this more than you have to? I think it's to the patient's advantage. I think it's the right thing to do to try to get as much density as possible. We take that strip from the back, 30 centimeters at minimum, 1 centimeter wide. If you have the elasticity, meaning that the edges of that strip come together easily or overlap, I make it a little wider. So we try to go for an additional strip to really maximize your results. And in summary, you can get to where you want to be. Your donor is basically a factor that goes into your density. Please call us here at Natural Transplants. Check out our website, naturaltransplants.com. I love the emails and feedback I've been getting from all my prospective patients. We'd love to see you here. Thank you.